And we're live. Hi, everyone. I hope that all of you are staying home. Welcome to Talking Live with Macy. I hope that right now, as you know the drill, I haven't seen you guys in about 2 to 3 weeks. So we'll wait for 15 people to join us on today's stream before we officially begin. What you should do now, if you're tuned into the stream, is please share this with your friends, with your family. We have 10 vouchers to be given out to 10 lucky winners. We have 100 ringgit Village Grocer vouchers plus Mommycare Programme vouchers from Prince Court Medical Center. That will be 1+1, so you get both vouchers for 10 lucky winners. So how do you win that? All you need to do is start typing in your questions. Just by asking questions, we'll randomly pick 10 lucky winners after the session is over. So it looks like the counter is running up. So continue to share this with your friends, with your family, with your relatives. We are hoping to see 15 people before we officially begin so that there will be continuous momentum and questions, and we get people to tune in to ask questions. I think that's the most important part, to find out more, be informed, be aware. We're going to wait just a couple of seconds rather than minutes. I believe that we need about 3 people, or maybe the counter is slow right now. So I will be checking in from time to time. Yes, pregnant ladies can join. We will actually encourage pregnant ladies to join today's stream. It looks like we have 15 people already, so I'm going to begin. Welcome once again, everyone, to Talking Live with Macy. Thank you so much for joining us here today. To all dads out there, happy Father's Day. During this time, I would like to share with you that we're actually running a giveaway today on today's session. It's a big giveaway with 100 ringgit Village Grocer vouchers plus the Mommycare Programme vouchers for 10 lucky winners. And how do you win it? All you need to do is just type in your questions. So please go ahead, do so now. Start asking questions, start sharing this live session out. So today's topic is a topic that is very close to my heart, simply because 2 years ago, I was misdiagnosed. I had prolonged period. And the gynecologist at that point of time actually diagnosed me with stress. She said I had stress. That's why my periods were so prolonged. And I of course trusted her. And then after a couple of months, when it continued, and I actually met Dr. Paul and Dr. Prashant, and that's how I was actually diagnosed with the condition that I had. It took a while, but I managed to find out what was wrong. I think that's the most important part. So if you're female, you have questions, it's very, very important to actually find out, especially for us females. We need to know our reproductive organs as well as our breasts, and we need to take care of it. So again, I cannot stress how important it is to share this session with all your female friends, relatives, and family out there, because they need to know and be aware. So right now, I actually have questions. For example, if I go to a gynae, what do I check? So if you have questions like that, if you're pregnant, can you take the vaccine, for example? Or if you're pregnant, you have issues with pregnancy, you want to ask those questions. If you have not gotten pregnant, you've been trying, you want to ask that question as well. Pcos, endometriosis, what are all these things? So if you have those questions, it's time to join us and ask those questions. So today, I would personally like to thank Prince Court Medical Center for sponsoring all the 10 vouchers that we'll be giving out. There will be 1+1, so 100 ringgit Village Grocer vouchers, plus the Mommycare Programme vouchers from Prince Court Medical Center to 10 lucky winners. And all you need to do is put in your questions. And the other thing is, my current gynecologist is here today. He's Dr. Paul Tay, a gynecologist and obstetrics specialist from Prince Court Medical Center. Hi, Dr. Paul. Thank you so much
Hello.
for joining us. So
good afternoon, everyone.
Good afternoon. So I will jump straight to the questions because I believe other people here have questions. So ladies, remember putting your questions, because by putting in those questions, that's actually how you win those vouchers. So Dr. Paul, I'll begin the question session first. So Dr. Paul, in terms of a regular gynae checkup, what are the common tests to include?
Yeah, I think for women, although they are well and appear healthy, they should do a gynecological checkup every 2 to 3 years, once every 2 to 3 years. And this checkup actually entails a pap smear and a HPV test. Pap smear actually is to detect any pre-malignant cells on the cervix, so that if we detect these lesions early, a simple treatment can easily avert a full development of cervical cancer. So pap smear actually is a very simple outpatient procedure. It takes about 5 minutes to do, pretty painless. And basically the cells are sampled and sent to the lab to check for any pre-malignant conditions. This is only done for women who are sexually active or previously sexually active. So if you're a virgin, there's actually no need to do it. All right. And if you're sexually active, you are aged between 25 to 65 years old, then you should consider doing this pap smear every 2 to 3 years, once every 2 to 3 years. All right. So apart from the pap smear, in a gynecological examination, the doctor will complete it doing a pelvic examination using an ultrasound scan to look for presence of any uterine fibroid or ovarian cyst. As you mentioned earlier, breast cancer also is the #1 cancer killer in women. About 1 in every 8 women in their lifetime will develop breast cancer. That's very, very common. So a regular checkup, a gynae checkup, will include the breast examination. If the woman is above 40 years old, the doctor will encourage them to do a mammogram. Mammogram is actually an X-ray to examine the breast for any abnormal lumps. Sometimes these sort of lumps grow very insidiously, and by normal manual palpation, you may not feel it yet. But with ultrasound, this X-ray examination, you can detect very small subclinical mass that can be a precursor of breast cancer. And it's been shown that mammogram has picked up many early breast cancer and saved women's life in that sense. Yeah, so these are generally the 3 main tests.
I see. Thanks, Dr. Paul. I think a lot of women, when they go to doctors, gynecologists, they don't know what to check, and sometimes they go in too late. So it's good that they are aware of these type of tests that they should be taking. So as a female, we hear the term Pcos and endometriosis a lot. What is the difference?
Pcos is Polycystic Ovarian Syndrome. It's a very common female disease. It usually is a hormonal disorder affecting women of reproductive age, but it can affect women as young as adolescents and to women as old as in their menopause, right? But mainly it's women of reproductive age. No one really understands how this happens. There's some suggestion that runs in the family, so that could be some genetic traits related to Pcos. More importantly, we do realize that the common pathway is in Pcos women, they all develop a condition called insulin resistance. Somehow, their body cells are not responsive to the normal insulin dose. So their body will have to produce more insulin to overcome that, to maintain a normal blood sugar level. That's normal for our body. Our body will respond certain hormones if our system are not working well. Yeah? But because of this insulin resistance, the excessive insulin will lead to excessive production of a hormone called androgen, which is a male hormone, which of course not so good for female. So it will cause women to have irregular periods. It can cause them to have excess hair growth, acne, for example, and also infertility. That's basically the principle in Pcos. Endometriosis, though, is very different. It's also very, very common, affect about maybe 15% of women at their reproductive age. And it is usually a very painful condition. Uterus is a very specific organ. In the middle of the uterus, there's this lining called endometrium, which is important for women to conceive. It acts like a bed for the baby to implant, and also for women to have a regular menstruation every month. So an endometrium should stay inside the uterus. It shouldn't be anywhere outside the body. But in endometriosis, for some reason which we still don't quite understand, this endometrium found its way outside the uterus. and it got implanted in places like ovaries, tubes, bowel, the guts, the pelvic floor, and even in the lung, as far as lung. And every month when women menstruate, this lining or this endometriosis will thicken, it will break down, and it will bleed. And you can imagine, because they are trapped in a confined space, so all this blood will basically accumulate and form a cyst, for example, like an ovarian cyst. And this is extremely painful. And it can also lead to chronic inflammation and scar formation, leading to different things like infertility, severe menstrual pain, and so on. So these are the two main conditions.
I see. Thanks a lot, Dr. Paul. I think a lot of females, they always wonder, what is PCOS or what is endometriosis. They probably don't know about it until they are diagnosed. So it's good to know the symptoms associated with that. But how do we manage PCOS and endometriosis?
Okay, Pcos symptoms are also a bit of a mixed bag. I didn't elaborate too much just now, so maybe I just elaborate now. So in the past, there are so many symptoms are sort of like related to PCOS, but some are real, some aren't real. But it makes the diagnosis very confusing. The doctors are confused, and definitely the patient are confused. So basically, a group of doctors has come together and come to a general consensus on how to diagnose PCOS in 2007. So they basically come out with three main symptoms. The first is that the women must have they have come up with three main symptoms. Women must have two of the three symptoms to be called PCOS. Two of the three, doesn't have to be all three. Yeah. The first symptom is actually irregular menstruation, meaning your cycle takes more than 35 days to come. Yeah? Or you have maybe less than 9 periods in a year. Yeah? That's called irregular menstruation. Second is that you have a polycystic ovary when you do an ultrasound scan. When you put in a vagina ultrasound, you can see that the ovaries are full of little black color grapes, more than 10 on each ovary. That's called PCO. And the third symptom is that you must have excessive androgen. As I said, PCOS is actually a male hormone condition. When you have excess male hormone, that will lead to excess hair growth on the body, on your face. It can cause excessive acne. And it can give you some male appearance like baldness and so on. So if you develop two of the three symptoms that I mentioned just now, it's called PCOS, right? PCOS can present in many ways. The commonest way they present, as I said earlier, is irregular period. So patient don't have a period regularly. They may have a period twice a year, 3 times a year. And when it comes, the bleeding can last very long. That's quite common. The second way to present is what we call infertility, whereby they tried many years, they tried extremely hard to conceive, but yet no success. That's partly because of the hyperandrogen, the excessive male hormone, making them infertile. And on the long run, this PCOS patient can also develop a thing called metabolic syndrome, whereby they have a higher chance of developing hypertension, diabetes, ischemic heart disease, so on and so forth. Yeah. For women with PCOS who fortunate enough to conceive, either naturally or by assisted conception, they also have higher risk of developing pregnancy-induced hypertension or a gestational diabetes, and they also have a higher chance of miscarriage as well. So actually, it's a very wide disease that affects women across all age groups. Yeah. So the treatment is really very much what they want, where they are. For example, if a single lady who doesn't want to get pregnant but have irregular period, so the management is to treat her menstrual problem. Just give her back a regular period. Just give her some hormonal pills and give her back a regular period. The problem about PCOS is that it is supposed to be a lifelong thing. It's not 1-2 months treatment. So they have to take this treatment fairly long term, which is the part that it's hardest to convince patients, because they all worried the treatment can cause other side effects and so on. So they are not very keen or rather reluctant to continue with the treatment long term. But one thing about Pcos is you need to have treatment a bit long term. Another group of patients who are married but have a fertility issue, then they may have to consider taking fertility pills or going through IUI or IVF to help them to conceive. For other older women, maybe close to the menopause, they already passed their adolescent problem, they already have their kids and so on, but they may suffer from hypertension or diabetes because of Pcos. Then the management will be different. So it depends where you are along your life. As I said, this condition affects girls from adolescent to reproductive life to menopause. So actually, you see a whole spectrum of them. So the disease is rather interesting and makes the treatment rather challenging as well. So that's for Pcos. For endometriosis, the treatment is a little bit more, I should say, better categorized, because in endometriosis, patients usually have two problems. One, they have severe menstrual pain, as I mentioned earlier, and two, a proportion of them will suffer from infertility. Again, cannot conceive. So again, for a young girl who doesn't want to get pregnant, the management is mainly pain management, just to make them pain-free, just to make their life as comfortable as possible so they can get on with their life. I've seen patients with endometriosis who suffer every month. Every month they had to take 3-4 days medical leave because the pain is so bad they had to stay at home with painkillers, injections, so on and so forth. So it can be very, very bad. So for this woman, the management is more for management of pain. For another group of patients who, again, married but have infertility problem, then the aim is to get them to pregnant. Whether they will require IUI or IVF treatment, that depends on the severity of the endometriosis. So the treatment very much depends on what patient wants, what they want.
Thanks a lot, Dr. Paul. I think it's a clear definition on the treatment management for both. It seems like Pcos is a bit more complicated, and like you said, for different stages in life. So besides the aforementioned diseases, Pcos and endometriosis, what other general gynae complications should women be aware of?
There's a lot, but since we already mentioned Pcos and endometriosis, I wouldn't do this talk any justice if I don't mention uterine fibroid. Fibroid is actually the third, one of the commonest gynecological problems that we see in the clinic. Fibroid is a layman term. The medical term is what we call leiomyoma. It's actually a smooth muscle tumor. When patients hear this word tumor, they think it's cancer. Actually, it's not. Majority of fibroid is not cancer. It's actually a benign growth on the uterus. And it's extremely common. About 25% of population in Asia would develop a fibroid of some sort. If you're in Africa, this incidence go up to 50%. So definitely there's a genetic trait to it. Most fibroid actually are very mild, very small, doesn't affect women in any way. If they don't go for a checkup at all, they may not even know they have one, right? The fibroid can be various sizes, can be as small as half a cm to 20 cm. It varies a lot. The shape can be different shape. It can be on different position, right? So the size and the position are quite important. The general teaching is if the fibroid is more than 5 cm in size, usually it will have some sort of a clinical implication. And the fibroid that is near the lining, the endometrial lining that I mentioned just now, what we call submucosa fibroid, they tend to cause problem. They will cause problem in terms of heavy menstruation, because if the fibroid is very close to your endometrium, that will increase the blood flow to that area. And every month when women bleeds, they tend to have a heavier bleed compared to an average person. So these women tend to be more anemic, they tend to be more tired, and they seem to have much heavier and more prolonged menses.
So
Submucous
uterine
fibroid.
fibroids.
This is uterine fibroid, and the one that's near the lining, not the one that's on the surface. Yeah, and also the other problem it can cause is also miscarriage, because if you have a fibroid that's very near to the endometrium, as I said, the endometrium is the bed for the baby to implant. So if the implantation has some problem, it may not implant, or implanted but miscarry. So the miscarriage rate and the infertility rate is higher. And the third issue is, as I mentioned just now, the infertility issue, because the embryo may not be able to implant. So this is a fairly common and can be some serious condition as well.
So the three main things that women should be aware of, like earlier, was Pcos, endometriosis, and uterine fibroids. I see.
These are basically
Okay.
the three main commonest problems. Of course, we do see other problems like patient looking for contraceptive advice or STD.
I mean, yes,
Yeah, but these are the
of
three
course.
most commonest. Yeah.
And the next question is, many people around me, to be frank, and in Malaysia, are facing fertility issues. Are you seeing this more often as well?
Definitely. Infertility has been on the rise since end of last century, in the 1990s, and is going up. So, give you an example, the census, the national statistics in UK show that the average age of women giving birth in 2000 is about 25 years old. When it comes to year 2010, 2012, the average age has lengthened to about 31, 32 years old. So one of the biggest factor is women are delaying their childbearing. They want to push everything backwards, right? So actually, and most people think that's not a problem, but actually it is a big problem. Why is that so? Because women is designed to have kids in their teens and in their early 20s. And after 30 years old, women's fertility start to decline, and the decline goes even faster after 35. And when women reach 40 years old, it is actually very difficult for them to conceive naturally. So this is a natural trend. But if you look at our current society now, the modern society, the girls are getting educated. They are going to university. In their early 20s, they are probably still under education, right? Or maybe just starting their career. And most women in the urban, like cities and so on, do work. They have a career and so on. And they probably start looking for a partner in their late 20s or even 30s. Very, very common nowadays. And they probably don't think about having their first child when in their mid 30s, some even early 40s. So it is no wonder infertility is going up and up. So that's actually the biggest reason, because of age. Second reason is probably due to the environmental factor. Our environment has more pollutions, like air pollution, where that's becoming a seasonal thing, where we have this haze in Malaysia or certain part of the world. The water we drink is probably more contaminated with hormones and so on. The food that we eat are becoming more processed, less natural food. And we are also exposed to many chemicals like makeup, the plastic wrappers. The thing that surround us that we think that does no harm to our health, but on the long run, prolonged exposure does has some certain impact on human fertility. Not just female, on male as well, both. So the environmental factor is actually quite important. And the third thing I can think of is our lifestyle. Our lifestyle also changing. We become more work orientated. We don't exercise so much. We tend to eat more. Our people tend to increase their body weight. The BMI is going up. Smoking and alcohol, not to mention that. I mean, that's actually becoming a big factor as well. So our lifestyle also have an impact on our fertility. Again, this applies to both men and women. So
I didn't know that.
Yeah, yeah. It's part of normality, isn't it? We begin to think that all these are very normal, but if you think about it deeper, it actually has impact on our fertility and our health. Mm,
So to summarize that, or rather recap that, for
mm,
those of you who are wondering, because fertility is a hot topic in people who
mm,
are trying to conceive.
mm,
So Dr. Paul mentioned that some of the factors, the main factor would be age, of course,
mm,
and the other factors would include the environmental factors like the water
mm,
we drink, or
mm,
even the processed food that we take, the lack of
mm,
exercise. All of these factors actually affect our fertility, both for
mm,
men and women. So,
mm,
once again, ladies and also the gentlemen who are watching this, please share this
mm,
video right now because
mm,
we want them to know. And instead of asking around or rather hearing old wives' tales, I think a lot of people do
mm,
that. We
mm,
want them to be aware and be informed. So please share this live. And also,
mm,
if you have questions, you can start putting them in right now because we're
mm.
giving away 10 vouchers, 100 ringgit Village Grocer vouchers and Mommycare Programme vouchers from Prince Court Medical Center. 10 lucky winners will be chosen just by asking questions. So if you have questions, I see your questions already coming in. We will address them in just a second because I have one last question for Dr. Paul. So,
Mm.
Dr. Paul, what are the known methods to conceive that you would recommend?
Of course, natural conception is the easiest and the best way, and the step number one that everybody takes, right? But of course, up to a certain point, if the natural conception doesn't work, it is important you seek help early. So normally, the definition of infertility is inability to conceive after you've been trying natural method for 12 months for women below 35 years old. For women above 35 years old, the definition is 6 months because we tend to think that older women, as I said earlier, is less fertile, tend to have more problems. So the definition below 35 is 12 months, above 35 6 months. So if you try this duration of time and do not conceive, then perhaps you should go to your doctor just to do some basic testing to see what's going on. Depending, of course, the treatment depends on the various causes, whether it's a sperm issue, whether it's a blocked tube, whether it's endometriosis, whether it's PCOS or whatever. The doctor will recommend certain treatment. The three broad categories for fertility treatment. The simplest category is the fertility pill, where we give patients what we call clomiphene citrate. It is a pill that tries to make end ovulatory women starting to ovulate. So this works best for example, the PCOS patients, right? It's a simple treatment, fairly cheap, good in making women ovulate, but doesn't always make women pregnant. Yeah, but that's step number one. If you want something a little bit more than just a fertility pill, then you can consider a treatment called intrauterine insemination. As the name suggests, we take the husband's sperm, give it a wash, and inseminate into the in the uterus of the women. That's a second method. Ultimately, the third method is what we call in vitro fertilization or IVF. This method has a highest pregnancy rate, but also expensive. But it basically cured almost every fertility issue, such as endometriosis, PCOS, low ovarian reserve for male infertility. So yeah, so these are the three main methods for fertility treatment.
I see. Okay, so when a person goes and see a fertility specialist, then they will advise based on all of the factors you mentioned earlier, their
Mm,
age, and also
mm,
whether they had any diseases
mm,
associated. Then you
mm.
advise which method to actually take, right?
Correct, correct,
All
yeah,
right.
correct. Mm, mm, mm,
So, ladies and gentlemen, now I will take your questions for
mm,
Dr. Paul. So
mm,
remember, continue to put them in
mm,
because you stand a chance just by putting to win the vouchers just by putting them in. So
mm,
I'll start first with Michelle's question.
mm.
She asks whether a pregnant lady can get the vaccine.
Yeah, actually, I've been receiving this question 3 times to 5 times a day. In fact, I was thinking of putting a TikTok video on this. But anyway, answer is yes, you must, definitely. The government spend a lot of money to vaccinate the population. They are not doing this to harm people, right? And although the vaccine is very, very new, but so is this disease. This virus is new. Because it's new and the disease is very deadly, so a lot of these vaccines are rushed through without the previous trial and so on and so forth. But like most vaccine in the world, they are all very, very safe, right? Although there's no phase 3, phase 4 study, 3 years, 5 years safety data and so on. But like I said, given the extraordinary circumstances, I think everyone should go for it. Now, in US, they have approved Pfizer to be safe in pregnancy, and they have done that as early as February this year. And following that, Europe countries like UK and most European countries also approving this medicine to be used in pregnancy as early as March or April. 2-3 weeks ago, our government, Kyrie, said that they are fast-tracking immunizing our pregnant women with Pfizer from about 3 weeks ago. So in fact, if you look into your MySejahtera, there is a tab for pregnant women. And you should update it and put in your expected date of delivery, and the government's supposed to call you up sooner. And I already have a few patients had received the appointment next week. So if you
this
are
is for Pfizer, right?
This is for Pfizer,
Okay.
yeah. Now, this thing changes very, very quick, and maybe it won't surprise me a month, 2 months later, they will say AstraZeneca will be receiving the same approval, or maybe even Sinovac. I don't know. I mean, this thing changes very quickly. Just keep updating. But as I said, almost all vaccines are very safe, with the exception of a few like rubella and all that having impact on pregnancy. But at the moment, if the government is offering you the injection, you should go for it, and they will be giving you Pfizer.
Okay. The next question is from Jehan. She says, "Hi doctor, I have Pcos and currently suffering with hair loss. Is there any supplements or medicine she can take that will help reduce the hair loss issue?"
Okay, supplement, no. If you said your Pcos is due to, your hair loss due to Pcos, then as I said earlier, this is an androgen problem. This is an issue whereby you have excessive male hormones, right? It's a hormonal issue. So there is a medication in the market called Diane. Diane 35 is a female name, Diane. It's actually a contraceptive pills. It has anti-androgen effect in it. So if you are not looking to get pregnant, and I assume you also have irregular period, with women with Pcos and hair loss quite often have irregular period. This Diane 35 will kill two birds with one stone. So not only it will make your period very regular, it also will suppress your androgen and improve your hair loss issue. But you have to be very patient, because hair loss, the hair follicle cycle is about 3 to 6 months. So you don't expect to see an impact within 1-2 months of taking this pill. You have to be patient and continue this for up to 3 to 6 months at least, to see an impact. And after that, if there's improvement, then you should continue on for another 6 months after that. So all in all, you probably need this treatment for about a year.
So it's called Diane 35.
Yeah. See a doctor. You probably can't purchase it over the counter, and but yes, there is a treatment for it. That's actually the only methods at this moment in time.
I see. Jehan, I hope that you can take this forward with the medication and speak to your doctor. And Corinne, she says that she's so worried her baby would have jaundice. How does she prevent it during pregnancy?
Preventable. It is well known that newborn, about 25-30% of newborn develop jaundice, and a good proportion of them do need some sort of treatment. The reason for jaundice is because the neonates, when they first born, in the first week to 10 days of life, their liver are not functioning as efficiently as we want it. So there's an excessive buildup of a thing called bilirubin in the system. And this bilirubin has this color pigment that make baby yellow or jaundice. And if you have excessive bilirubin in your system, it can affect the baby's health. So actually the treatment is very simple. You just have to go under this phototherapy. They put the baby under some ultraviolet light for a day, sometimes two, and that will help to break down the excessive bilirubin, and that's the cure. And it's just to buy you time. The baby liver will starting to become matured and starting to function normally. It doesn't mean something is wrong with the baby.
I
It
had
just takes
jaundice.
when you were a baby, right? Yeah, it's so
Yeah.
common. I probably had it, just my mother never tell me. It is so common. It's nothing serious. Of course, the old folks will tell you that it is a color issue, then you should drink coconut water, that fade away the color and so on. But actually, no. If you think about the pathophysiology, it's not a color issue. It's actually a bilirubin issue. And it's because your liver, your baby's liver is not functioning so well. There are certain risk factors like your blood group, how traumatic is the delivery, whether there's any hemolysis happen in the baby. It's multifactorial. Yeah, it's unpredictable, and the doctor don't even know on the day when the baby is born. The first question patient asks me is, at the baby is born, oh, is my baby going to get jaundice? I say, I don't know. Ask me that a week later. Even at birth, I won't know, and you only discover it about 5 days. Sometimes early will be 2 days, sometimes about 7 days after birth. Yeah. Because at birth, at the time of birth, baby's bilirubin are washed away by the mother's system, because the baby is linked to the mother, right? So you won't see at birth because the mother is doing all the work for the baby. So the moment you detach the umbilical cord, the baby's system will have to start functioning, and that's where the bilirubin get accumulated. But before that, you won't, because the mother is doing all the work.
Okay.
Right?
So to answer that question, Corinne, there's no prevention, and drinking coconut water will not help.
And it's not because you eat too much papaya either.
Yeah.
Yeah.
I think maybe some people think, right?
Yeah, it's a
Okay, the
color
next
thing,
question.
right? Yeah.
Yeah. The next question is from Cherry Yap. She says, "Hi doctor, if I previously took Gardasil jab 6 years ago, how often would she need to take the jab again?"
At the moment, the company said no need. It's supposed to be lifelong.
Okay.
But if you have
Lifelong.
it 6 years ago, it's probably Gardasil 4. So because you see, again, this vaccine advanced with time. So when it first came out, they immunized you. It's called Gardasil 4, 16, 18, and the other two, 6 and 8. So basically, they immunize you against 4 types of commonest HPV. Now, for the last 4 years, I think, they come up with a thing called Gardasil 9, whereby they add in a few more subtypes. Now, is there any need to spend another lot of, there's another cost to it if you want to immunize again? I personally think there's no need to. If you already immunized with Gardasil 4 6 years ago, I don't necessarily think you need to go for another new jab of Gardasil 9. But important thing is to continue doing a pap smear, yeah, because if you already have the Gardasil 4 6 years ago, your chances of cervical cancer already reduced by at least 50%. So the other 50% you rely on pap smear to detect it. Now, even if you go for Gardasil 9 now, doesn't mean that it's 100% protected. There are still certain subtypes of HPV that we cannot prevent yet. So one way or the other, you still need your pap smear. So I would say you rather stick to your pap smear every 2-3 years once. That will be fine.
Okay, thank you. And Ms. Tay asks, "Hi doctor, can obesity cause failure of IVF implantation?"
Yes. Obesity, definitely. Obesity definition is BMI above 30, right? So for example, if she's an average height of 155 cm, this lady must be 80-90 kg in body weight or above. So definitely. So when you're obese, your fertility drugs, the dosage of fertility drugs increase are needed. You need more. So for example, you're supposed to produce 10 eggs in IVF. If you're obese, you may only produce 6.
I see.
And sometimes your egg quality may be poorer. Uh, and if you're obese, your cycle tend to be more irregular. So during the cycle of frozen embryo transfer, it may be slightly more difficult as well. So that overall, obesity do carry a lower IVF implantation rate. But again, as I said to you, IVF failure is multifactorial, right? You can't just say, oh, it's obesity and nothing else. It depends on many factors. As I mentioned earlier, it could be her age, husband's sperm, the uterine condition, whether there's any fibroid presence, whether there's endometriosis. I don't know. I mean, but obesity per se does reduce your implantation a little bit. Yes, it's true.
Okay. And Carmen had a question on the vaccine again. She says, why the Pfizer vaccine is only available for pregnant ladies of up to 33 weeks? What's the concern after the 33rd week?
I think the reason is because it takes a few weeks or 1-2 months to mount an immune response. Yeah. So when you're about 33 weeks, by the time you mount a response, you probably will deliver or already in the process of delivery. So your baby may not get the same sort of protection as you want. So if you have it below 33 weeks, your antibodies, the COVID antibodies produced in the system will cross the placenta and pass to the baby as well. And the baby will get some degree of passive immunization at birth. So that's basically the advantage. If you are past 33 weeks, the baby may not get that much passive immunization, but doesn't mean that the government won't immunize you. They also say lactating mother can be immunized. So if they don't, let's say if you are 34 weeks now, the government don't call you, but they probably call you after you give birth, after your due date, when you're giving birth. Yeah, when you're breastfeeding, I mean, sorry.
All right. So, Dr. Paul, there are many questions. I will just take like maybe 5 or 6 more. CT asks, does it can peak? Okay, so I guess the first question you already mentioned, Pcos cannot be fully cured. It's a lifelong thing. And she asks, are there any long-term effects of Pcos?
Okay, although I say it's not fully cured, but you can minimize the severity. You can make things better by lifestyle changes. Lifestyle changes, by that I mean maintain your body weight, because as I said, most of these people are overweight or obese. So lifestyle changes is number one thing in PCOS, which is the hardest thing to do because these women tend to have a lower metabolism. They are prone to gain weight. They eat a little, they gain weight. And it's been like that since a teenager. So although it sounded easy, but it's not easy. It's quite a difficult thing to do. But I have patients who done it and they maintain it. And the PCOS tend to be much milder. They don't have much problem. It's about your body weight, about your body mass index. You have to get your body weight to a normal range. And although I can't guarantee a full cure, but definitely the severity will be much lower.
Yeah. So lifestyle changes is a very important factor to manage and control
exercise
PCOS.
And diet. Exercise and diet. There's no magic way around it. Of course, most people tend to take pills and say, "Oh, give me pills," weight loose pills and all that, or they go to the slimming centers. That's not the way, because how can you go to a slimming center lifelong?
Yeah, it's expensive.
It's expensive. Yeah. It's not safe also to do it too long. So it's best is your lifestyle modification, exercise and diet lifelong. Yeah.
So the next question is Vera had is her teenagers probably having frequent irregular menstruations. What treatment can be done? And when they bleed, it's heavy and makes them weak. So
actually, it's a very common condition. It's called a primary dysmenorrhea. It's actually teenagers, their pituitary gland. Pituitary gland is a gland in the middle of the brain. It secretes the hormone to control women's uterus, the uterine bleed and so on. So young girls, teenagers, they tend to have an immature pituitary gland functions. So that's why the period tend to be irregular or sometimes frequent or sometimes very painful. But they tend to grow out of it. As they get older, when they reach their 20s or early 30s, or even after they have a baby, they tend to improve. It's not a permanent disease as such. Of course, there are some women do have, like I said, early sign of Pcos. So that's a bit difficult to differentiate, and they had to be judged on case basis. But I'm just talking about generally, teenager having frequent irregular period is rather common.
Okay.
Yeah.
And Debbie asks, is it necessary to take hormone pills after recovering from endometriosis surgery?
Well, necessary, I won't say it's necessary. It depends on circumstances. If you want to conceive right after the surgery, because after endometriotic surgery, sometimes your fertility potential increases. So if you really want to get pregnant and you want to use that opportunity, then don't take hormonal pills, because that will interfere with ovulation and your fertility. If you are not looking to get pregnant and to prevent the recurrent endometriosis, then hormonal pill is actually a very useful method. Because endometriosis is well known to recur, and doctors often give pills to prevent that recurrence.
Okay. April asks, will endometriosis cause weight gain and bloating?
Weight gain and bloating. Endometriosis, no.
Okay.
Endometriosis is not a hormonal thing. PCOS is a hormonal thing. Endometriosis is actually endometrial tissue that is located
Going
in
to
an
other
abnormal
areas.
area. Exactly. So it doesn't increase your weight as such. Yeah. You may have other underlying issue, or maybe you didn't exercise enough, or your calorie intake is a bit too high for your needs. Yeah. Yeah.
I know, ladies, I know you all have a lot of questions. So I'll pick those that are not from the same people, just to give a chance for Dr. Paul to answer some other people's questions. Nara asks, will endometriosis affect menopausal women? If yes, what's the reason?
The answer is no, it shouldn't. One of the best cure for endometriosis is menopause. Yeah, because endometriosis, if you think about it, endometrium relies on hormones to grow, right? Women have a menstrual cycle pre-menopause because they have hormones, right? So the endometrium needs estrogen and progesterone. So, and whether it is endometriosis or normal endometrium, you need estrogen and progesterone. So the moment you are short of estrogen and progesterone, i.e. menopause, in theory, your endometriosis is cured. No issue. It's a
Wow.
permanent cure.
Okay.
Yeah. So one of the treatment for endometriosis is to what we call pseudo menopause. We make women temporary menopause. Correct. Then they are also the cure. So no, endometriosis should be gone after menopause.
Okay, so I'll take two more questions. One is from Tang Man Hoi. He asks, for men's infertility due to sluggish sperms, is there a treatment or supplement to make sperms more active?
There is. In theory, there is things like zinc, vitamin E, antioxidant like folate, CoQ10, that sort of thing can take. So in terms of clinical proof that it helps the sperm, that's not much. But I suppose all these pills does no harm, right? It's only vitamins. So at best, it doesn't do any harm. At worst, it doesn't do any harm. At best, it may improve your husband's sperm motility. So I will encourage you to take that. If you're going to see my battery is running low. Hang on a second. Okay, good. So if you're but if you're going to take it, you can try it for about 3 to 4 months. And if you're going to see a benefit or impact, that will be it. If you've been taking it for more than 4 months or 6 months and there's no improvement, don't waste your time. Yeah, there's only so much this vitamins or supplement can do. It doesn't work for everyone. Of course, apart from supplement and vitamins, your husband should reduce his stress, maybe get more sleep. Sleep is very important for men's sperm. Exercise is important. It sort of like produce some endorphin that makes them feel better. Adequate sleep, meaning about 7-8 hours a day. That sort of thing helps. And balanced diet. Don't avoid alcohol and smoking, as I mentioned earlier.
Okay. So, Dr. Paul, I think I'll take two more questions. One of them is actually from your patient. So the one before that would be Shiman. She asked whether PCOS can be healed naturally with a specific natural diet. That means without taking any medication, just through changing their diet and exercising. Is that possible?
Well, it depends how severe your PCOS are. I mean, like every disease that can be mild, moderate, severe. If you're talking about the moderate to severe PCOS, I doubt it very much. There are some women, as I said, again, the diagnosis of PCOS has to be firm, in the past, people are wrongly diagnosed with PCOS because the definition is very loose. Your definition may be different from mine. Only until the last 13, 14 years, then there's a group of experts came together and defined PCOS and makes life a lot easier now. But still, once in a while, we do see patients misdiagnosed with PCOS. So first of all, you have to be properly diagnosed. I have patients who came and said, "Oh, the doctor did the scan and called me PCOS." Well, as I said, that's not the way to diagnose it. I just said just now, you need the two of the three diagnostic criteria to be called PCOS. So first of all, you have to make sure you are properly diagnosed. Once you're properly diagnosed, then it depends on severity. As I said, if you are having the mild PCOS, you can conceive once in a while. Your periods will be irregular, especially when you're stressed. I think all you need is just to lose weight and change your lifestyle. That's probably good enough. You don't need to take any medications, and just go for blood pressure checking. Check your sugar level to make sure you're not diabetic. I think that's all you need. So the answer is yes. I suppose it can be done. Yeah.
Okay. And your patient asks, she says she's a breastfeeding mom and pregnant now, but her breast milk is very little. And she has to stop and give her baby formula milk now. Is it normal? Her baby is
Yeah.
15 months and she's 13 weeks pregnant. She's your patient.
Yeah.
Okay.
Yeah, definitely. Because when you are pregnant, your estrogen will suppress your prolactin, your milk production hormone. So that's a natural process.
Okay.
So the moment you're pregnant, you will see a dramatic reduction in your milk supply. That's first. Second thing is your baby is already 15 months old. A 15 months old baby will start solid food. Quite a lot of solid food. So actually, the demand on your breast milk is also equally reduced. So
Okay.
by nature, but by natural reasons, your body already reducing production. Plus the fact you're pregnant, of course, you reduce even
Yeah.
more. So it is a good
Okay.
time. I'll tell my patient this is a good time to wean your baby off. Because all the breast milk benefit is probably done. You don't get a lot of benefit by continuing the breastfeeding. But if you really enjoy doing it, it doesn't take a lot of your time, fine, just do it. But if you find it so troublesome, this is actually a good time to stop.
Okay. Thanks a lot, Dr. Paul.
Okay, all right.
I think there are more questions, but I guess I won't be taking them.
Okay, all right.
So for those of you who have put in questions, we will pick the 10 winners from all of the questions that were put in. And thanks a lot, Dr. Paul from Prince Court
Thank
Medical
you.
Center for answering all the questions. Actually, Dr. Paul, there's one more question that is asked by a guy. Can I ask it?
Sure.
Because there's so few guys joining today's session. So Lim Boon Wee asked, what are the common causes of male infertility besides low sperm count?
Common causes of male infertility. Actually, multifactorial again. Some men are born with low sperm count.
Okay.
There are many reasons. One of the latest thing that found is that actually that could be a thing called microdeletion of Y chromosomes. So some men are born with this condition, and they are from the day they were born, they have low sperm count. But because when you go to see a doctor, you don't usually check a sperm count, isn't it? You only check a sperm count when you can't have a baby. So it's only discovered way later in life. So if you have this microdeletion of Y chromosome, you have this problem for life. Of course, there are some men who are genetically predisposed to low sperm count, and certain environmental factor makes it that way. Like I mentioned earlier, the water we drink, the pollution, the food, the obesity, the smoking, the alcohol, the environmental factor, that will have a role to play. So it is a very broad question that I don't have one direct answer. It's multifactorial.
Okay.
Um, and it's relatively common. It's relatively common.
Okay. Thanks a lot, Dr. Paul, for
Okay.
answering
All right.
all of the questions.
Okay.
Thank
All
you
right.
once again. Have a good Sunday. Happy Father's Day. I know you are a father too. And happy Father's Day to everyone. Thank you
Yeah.
so much, everyone. And thank you, Prince Scott Medical Center, for sponsoring the vouchers for today. Have a good day, everyone, and happy Sunday. Thanks a lot,
Okay.
Dr. Paul.
Thank you.
Okay.
Thanks for joining today.
Bye.
Bye.
Bye, everyone.